Dr. Mahmood Butt, and I'm a British trained and certified consultant interventional cardiologist and director of cardiac catheterization laboratory at King's College Hospital in Dubai.
How can we, if we can, prevent coronary artery disease? Is it in our confines that we can stop somebody from developing coronary artery disease? The answer is not a clear yes. However, it doesn't necessarily be disappointing news that we cannot do anything about it. As I mentioned earlier, that there are things that you can change and there are things you can't. And the things you can't change, of course, they are the genetics. The genetic makeup doesn't change and you transmit that. Of course, with multiple risk factors, particularly if you don't look after yourself, there's evidence that your genetic makeup will get worse in future as well. So your future generations will have worsening of the coronary artery disease. That might mean worse distribution of the coronary artery disease, or they develop it sooner than you did. Similarly, the age is another factor. And if somebody is developing it after the age of 55 or 60, that's understandable. If somebody is developing in the age of 35, that is something that we need to look into. The modifiable factors, they have become really important over the time. And when I talk about modifiable factors such as diabetes, blood pressure, cholesterol, I actually take a step further and I talk about preventing those factors themselves in the first place. And that is where the preventive cardiology and preventive medicine gets in. The catchword for this is a good lifestyle. Surely if you have genes that you were destined to have the diabetes, there's very little you can do about. However, a lot of times it's a lifestyle that decides whether you will have high blood pressure or diabetes or cholesterol. Similarly, it's your choice that you smoke. And similarly, it is your choice that you tend to be overweight and not going to gym or taking activities that keeps your body weight within the normality. So I very strongly recommend to people to look after their lifestyle at a rather early age, because by the time you're 40, those lifestyle have impacted on your genes enough that if you're supposed to have diabetes, you will have developed diabetes. They are too late by then. So if somebody is in their 20s and they don't have a good lifestyle for the next 15 years, it's very likely that they will have diabetes or blood pressure, cholesterol, or if they smoke, they might have a coronary artery disease by then. If you change the lifestyle at that time, surely you will do some good to you, and also you will reduce your chances. But not only the pace of recovery is very slow, but also it takes more than 5 years for a smoker to get back to a non-smoking level the day you quit. So it's very important that from the very early phase that we educate our children, our teens, and the younger population that they have to attain a very, very good and healthy lifestyle. We have enough pollution and enough chemicals in our air that might be poisonous, and we don't know, and we don't have much scientific data to prove whether that's an impact. However, we should do what we can do. And as I keep emphasizing on these factors, that these things are within our control. It is in my control that I control my weight, my smoking habits. If I do smoke, I should quit. If I have a younger population or a younger relative, I would suggest that they should do regular activities, exercises, to make sure that the risk of diabetes and blood pressure and cholesterol is low. And this is how, once they have developed it, there is very little you can do about it. Once you have diabetes, you will take the medicine for the rest of your life. And if you have it, your risk of having a heart problem will always be higher than a non-diabetic patient. So the key word here is a lifestyle, really. So I would suggest that everyone should look after the lifestyle at a rather early age.